When United States Marine Clayton Treska was diagnosed with terminal testicular cancer in 2009, his prognosis was grim. 6 months to live. Clayton underwent chemotherapy regimens and then 2 autologous high-dose chemos with stem cell transplant. He also relied on yoga, meditation, supplementary diets, and exercise. Since he didn't have family around and his friends chose to leave him, he leaned on principles to stay the course. He tries to be outside as much as possible and is learning to surf. He's also training to solo swim the Catalina Channel. He now eats healthy, organic foods. He avoids greasy, fast, and processed foods, complex carbs, and simple sugars. Has he ever cheated? Yes, but not much. He's regimented enough to eat healthy and only wavers from time to time. He doesn't fear death since he has experienced it firsthand with his career in the Marines. The only thing he fears is regret. He attributes his survival to an expert doctor who recommended a new treatment, the autologous stem cell transplant with high-dose chemo, but also being goal-oriented to focus on something other than being sick. Yes, Clayton decided to pursue the sport of triathlon when given his terminal diagnosis. He didn't know if it was possible, but the only thing that mattered was making it to the next day alive and going to bed knowing that he did the best with the time he was given. A year after terminal diagnosis, Clayton crossed the finish line at the Ironman World Championships. 6 months to live, thriving 3 years later. The Thrive Channel congratulates Clayton Treska, ultimate survivor. I am a breast cancer survivor, a blood cancer survivor.
I'm Dr. Holly Lucille, a naturopathic doctor.
I am a mom of a teenager, a basset hound owner, a military wife.
My name is Dr. Deanna Atai, and I'm a breast surgeon.
I am a cancer survivor who is looking for answers just like you.
I'm Deborah Tripathi. I'm a medical oncologist.
What works, what doesn't? Welcome to Thrive with Namrata. I want to know from you guys what your thoughts are on exercise after cancer. And as Dr. Tripathi said, it's one of the ways of getting that oxygen. Does oxygen truly heal cells? And if it does, why not more oxygen therapy after cancer to heal those cells?
Well, I don't think that exercise is only about oxygen. There's a lot of metabolic effects from exercise, such as lowering insulin and insulin-like growth factor and things of that nature that can also help. There are retrospective studies that look at cancer survivors, both breast and colorectal, and looking at the level of exercise they've had over their life or since their diagnosis that show fewer recurrences among exercisers. Now, that doesn't prove that the exercise caused it, because it could be some other healthy lifestyle aspect that made a difference and not the exercise, but it certainly points to the potential for exercise to help. So we now recommend, in the American Society of Clinical Oncology and the American Cancer Society, are all recommending a prudent diet as well as exercise for all cancer survivors. The question about oxygen is a separate one. While exercise does influence oxygen levels, it does many other things. Oxygen on its own could help, for example, standard therapies like chemotherapy and radiation therapy work better. There are centers that do hyperbaric oxygen, but none of this is yet proven, so I don't think it's quite ready for prime time. For those that advocate hyperbaric oxygen, my answer is, let's do a clinical trial.
Have you had people in your practice do oxygen therapy, and how has that worked out for them?
I've had some of my patients tell me that they've done it. I can't say that I have enough patients to make any comment as to how they've done, but like I said, in order to really understand these effects, you have to study really large numbers of patients in a systematic, well-designed clinical trial.
And as we talked about in the episode on supplements, more of a good thing is not necessarily better. Hyperbaric oxygen actually has a lot of toxicity to it, to just the increased pressure. So it's not something that people should just be going and doing on their own without the data supporting it.
But I have definitely seen in a couple of cases in my practice using hyperbaric oxygen for wound healing in particular.
Yeah. And then that has been studied very well, and that is an effective therapy, but that's something a little bit different.
Clayton, thank you for being an ultimate survivor and ultimate thriver. We'll see you next week.